PTSD is an anxiety disorder that affects some people after exposure to severe psychological trauma, such as what a soldier might see on the battlefield, or what police or first responders see after responding to an accident call, or what civilians might experience after sexual assault. And patients with PTSD have intrusive re-experiencing of these traumatic events through nightmares or other types of flashbacks. And they also may become so disabled by their anxiety that they avoid situations that remind them of the trauma. So the first project involves a clinical trial to try and see whether we can treat these symptoms. And it's based on the idea that memories, when they're recalled in the present, have to be reconsolidated in the same way that they were consolidated into long-term memory in the first place. So this clinical trial involves patients who have depression and who also have PTSD because they're comorbid often. And our hypothesis is that those patients that reactivate the traumatic memory will have the same side effects that people have from ECT in general, which is a short-term amnesia, but that it will specifically affect the reconsolidation of the traumatic memory that was recalled. The second PTSD project involves a chemical biomarker. So we think this is a project that I'm doing in conjunction with Dr. Wong at the Center for Addiction and Mental Health. So we think we've identified a part of a pathway that's involved in consolidating the fear response after a psychological trauma, for example. And so we think that changes in this pathway could both be used as a diagnostic biomarker, but that this could also be targeted by a new treatment to prevent PTSD. So the key advantage of this particular pathway would be that one could give a treatment after exposure to trauma to prevent the later emergence of PTSD symptoms. And obviously prevention is better than treatment, and we really don't have this kind of approach for any psychiatric disorder. So the potential impact, I think, of this would be very, very great.